And that is, I think, what is the most common problem with a lot of our community, is that they think that if you take antibiotics, it's going to get better.
Right.
And Z-Pak, which is what was what Narenji said,
Yeah.
is really not the cure for a common cold.
Right.
So the common cold is usually viral in nature.
Yeah.
So well, let's even step back a little bit more basic. People
Yeah.
talk about germs. So germs are of many different types. So one of the common ones are viruses, and then they're bacterial. Bacterials are what require antibiotics,
Yeah.
but viral does not, and it's self-limiting, meaning
Yeah.
it'll go away on its own. So if it's a viral, you don't need antibiotics. So Narenji, you do not need to take a Z-Pak for this. Now, once you have a cold,
Are you trying to tell him that there's no hope that it'll go away by itself?
I'm sorry, I guess we were not able to hear you properly on here, so I couldn't hear your question. I know we're having some technical issues here today, so bear with us as we get through this.
Yeah. No, Naveen, what I'm asking is how do you know whether you have a viral or the other bacterial or some kind of infection and without going to a doctor? Is there a way to find out?
That's an excellent question.
Yeah, I don't think that there is a way exactly that you can tell. Sometimes viral and bacterial can be confusing, but based on the symptoms and based on the examination done by the physician is when you can decide if it is viral or if it is bacterial. There are some bacterial illnesses that you can test and you can go ahead and tell if it is bacterial or not. But most of the viral illnesses you're not able to test for. And we just go ahead and do it based on experience and what the symptoms are.
And are there some people who are more prone to it, or are the seasons where we are more prone to it?
Right. Usually, I think we all think about the winter season as the season where we're going to get a lot sicker. But
Yeah.
each type of virus has its own season
Right.
that it flourishes in, and that is the season where that illness takes more
Okay.
hold.
Okay.
I think we have another call. Should we take that?
Sure.
I'll try on this. Hello, you're on air.
Phone number again, because earlier when you announced it didn't come out clearly.
Okay, thanks. The phone number to the studio is 732
819.
no to
No.
the studio
No, it's
297
8800.
9886, and I think most of the audience knows what the studio number is. It's 732-297-9886.
Yeah.
So we are here talking about common colds, and with me we have Anika as my co-host, and
Hello, co-host Dr. Naveen Mehrotra.
and we have been doing this show on integrative pediatrics, so trying to take the best of the mainstream medication treatments along with the best in alternative treatments. So making them more complementary treatments, and therefore the term integrative.
And I know that we're going to be talking about coughs and colds today, like the person who just called. And I have brought to the studio my medicine, and my husband calls it, he thinks that to me, this is like the cure for cough, cold, fever, AIDS, maybe even the economy. This is Vicks Vaporub. I have to tell you this. I know I'm going to sound terrible, but I do not leave home without it. There's one in my car. Everywhere that I've traveled, I have carried it. Is this part of, you think, integrative medicine?
Of course it is. And I think we'll get into it. I think we just have another call that
we
maybe
need to take. Okay.
If I can figure this out. Hello, you're on air.
Yeah, hi. I have a question regarding my kid. She goes to daycare and she's 2.5. And the daycare guys take her out to play every day, even if it's so cold outside. So my question is the cold weather outside bad for the kid, or they say that by law they're allowed to go in outside the fresh air?
Sure. Great question, and I think it's a very common question. So if I'll just lower your mic here, and then I'll talk on there. So this is a very common question that people have. Is it's cold outside, and my kid is being taken out by the daycare by law. The cold temperature in itself does not cause the cold. There are some kids who are predisposed to having what we call asthmatic tendencies. So the cold temperature can trigger off a cough, and it can mimic these cold symptoms. So that's where the whole mythology or the whole old wives' tales and the grandmas telling us that don't go out into the cold, make sure you're protected. And that is to make sure that the temperature does not affect your body and manifest with those symptoms. So the cold temperature in itself will not do it.
Okay. Cold does not cause the common cold.
Right.
Okay.
Okay. And a lot of these personal questions, we really don't want to answer as medical advice on this. And whatever we are saying should not be taken as a medical advice.
Even though you are a doctor.
Right. And I am a pediatrician, so
Yes.
I will try to address these questions as much as I possibly can.
Yeah.
So what I think you've described is, in some kids, what we see is through the night when they're laying down, the mucus tends to pool in the back of the throat, and in the morning time, that mucus can cause them to cough, and trying to get rid of that mucus, and once you get rid of the mucus, then you're pretty much okay. The details of what this gentleman has described really I'm not going to get into, but more commonly it is just that through the night these mucus just piles up there.
Yeah.
And especially in the season when this is also allergy season, it tends to build up a lot more of that mucus. And in the kids, what we recommend at that time is to make sure that they're sleeping with their heads or upper half of the body elevated.
So
Maybe
you mean
putting
like a pillow or a double
like
pillow?
a pillow, right?
Yeah,
And
yeah.
putting some sort of a humidifier and maybe using some steam.
Right.
And here is where we might use your
Vicks vapor.
Vicks
My
vapor rub.
Vicks vapor rub. But I mean, coming back to the gentleman, and I'm really sorry we didn't get his name. He really did sound troubled. People
Right.
think that just because it's called the common cold, it does. It can cause a lot of anxiety.
And the symptoms can be more of a nuisance, and they can be lingering on for a long time.
Yeah.
And this is where I think being in constant touch with your physician, your primary care physician,
Right.
and making sure going back to them again and again in the sense of, hey, this is not getting better or that's not getting better, and trying to cover all bases. And then if nothing works, just trying to come up with maybe an integrative approach to what can be used and what may not be used.
So when you're talking to your doctor, I think your advice, Dr. Malhotra, is do not take it lightly if it's something that is recurring. Do not take it lightly. It's not like you're pestering your physician.
Right.
You have to be selfish about your own health, and it's okay to go back and say that something is not getting better. Am I right?
That is true.
Okay.
And persistence hopefully will pay off.
Right.
So
You mean he will not throw my file out, but he will.
because you're trying to get to the bottom, and a lot
Yeah.
of times medicine is not an exact science,
Right.
and we can keep on researching and doing this test and that test, and that's where I think Western
Right.
medicine tends to get a lot of bad name.
Yeah.
Because we tend to do every single possible test under the sun,
Yeah.
and that's just because we're trying to make sure that we have not missed anything.
Right. So, I mean, just as a mother, between my son who was born 8.5 years ago and my daughter who was born almost 6 years ago, and now, I remember that, FDA went from give Tylenol to the child or, give cough and cold medicine to come back to do not give anything to, I remember almost 2 years ago, where you couldn't find Tylenol, to now where you cannot get Tylenol without actually going to the to the pharmacist. So what's going on? Can you help us shed some light
So
on?
let's say a child has a cold.
Yeah.
The cold can have many different manifestations. It can be just nasal congestion. It can be this lingering running nose. It can be this cough. It can be a morning time cough.
Yeah.
So a lot of different symptoms that can happen. Along with it, you may get a low grade fever.
Yeah.
And you just don't know. You cannot shake it, or you
Yeah.
get better, and then within
And as a mom,
week.
I love multi-symptom. Let me tell you, I'm like, okay, cough, cold, fever,
So
take care of
then
everything.
the parents like, okay, well, what do I do?
Yeah.
Then they go to the pharmacy, and
Yeah.
at the pharmacy there are tons and tons of different medications.
Yes.
Okay, so
Yes.
there are all these multi-symptom medications, generic medications,
Yes.
brand name medications,
Yes.
and the parents are just totally confused as
Yeah.
to what needs to get done. And then a medication that the physician might have prescribed may not be available, or the physician may have said,
Right.
take this and no longer there.
Right.
So the FDA does constant monitoring,
Yeah.
and they may pull off different medications off the shelf as they see fit. So, or if there is an issue with the medication. So, about a couple of years ago, Tylenol was recalled because there was issues about how it was packaged, how it was made. Then a lot of these cough and cold medications were pulled off the market because the side effects of the medications were kind of risky.
Yeah.
So just because it's over the counter doesn't mean
It is safe.
that it is safe.
Yes.
So as the FDA does the monitoring, they go ahead and pull this off.
Yeah.
So just recently, about a week or two ago, if people haven't heard about it,
Yeah.
Tylenol was recalled again in certain batches, and that is because and it was something very simple, something very basic, which we may not have even batted an eye if we were in India
Yeah.
or any other country outside. Is that the measurement syringe that was in the bottle didn't have the proper marking on it.
Which
Right?
means that
Which
somebody
means-
could give their child more medicine.
Right, so they could give the wrong medication.
Yeah.
And unless you know how to dose
Yeah.
the medication, you
Yeah.
may not give the right amount.
Right.
So obviously FDA ordered the Tylenol took a voluntary recall
Yeah.
and took that off the market.
Yeah. Yeah.
Just for safety purpose,
Right.
which is a great thing because I
Right.
think that monitoring needs to happen.
Right. So I want to remind people that the show is called In Conversation. We're having a show about a conversation about integrative pediatrics, and the idea is to get people on the phone, just like we had callers earlier, and to be part of this community. We are in conversation with Dr. Naveen Mehrotra, who of course is board certified in pediatrics. I laugh every time I have to introduce him because everybody knows you. And me, who people will hopefully know. My name's Anika. I'm here to represent the parenthood community as a mother of two. And, we are in this show every 2 weeks on Fridays. And we also have a community called My Whole Child on Facebook, as well as a website.
Right, so we do have a website called mywholechild.org.
Yes.
And we have a Facebook community where we want people to come in and share their experiences and talk about these alternative therapies and complementary therapies that they can use.
Yes.
So one of the common things for a common cold, obviously, I think anybody who's of South Asian origin is, you talk about haldi,
Haldi and
you
milk,
talk about
right?
ginger,
Yeah.
you talk about Vicks.
I want to remind you that those are also grandma's tales. You started by saying, "Oh, the grandma's tale." This is, these are all passed down from generation to generation.
Generation
right?
to generation, and there is something to be said about that. That
Okay.
you cannot take them lightly. Vitamin C. I mean, there are a
Right.
lot of different things that people can take,
Yeah.
which may or may not benefit,
Right.
but really are not going to harm if they're taken appropriately.
Correct. And at least they don't have side effects. I mean, what is the side effect of orange juice unless you're
Well,
allergic to it or something?
right. So the thing is also you need to know the dose
Yeah.
of how to take the orange juice or the
Yeah.
vitamin C.
Yeah.
So really, if you're looking to take vitamin C to help with your cold,
Yeah.
it really should be up to about 1 to 2 grams a day,
Right.
which is a pretty hefty dose.
Right.
And you have to drink about 5 to 6 cups of orange juice to get that. So you may have to take a supplement. So if you're just
Right.
taking a glass of orange juice may not be sufficient. And you can say,
Right.
well, why should I even take the orange juice?
Correct. So don't give
So
up.
don't-
Everything is a process.
Right, and knowing how to use these other things. So if your mom or your grandmom puts haldi into your milk
Yeah.
and tells you to drink that, and so it'll help with your cold,
Yeah.
there is something to be said about that because now there is a lot of research that's coming out which shows that turmeric or the byproduct of turmeric,
Yeah.
curcumin,
Yeah.
has benefits to it.
And like we've spoken about, integrated pediatrics, is not just about the Indian side, the Ayurvedic side, and the Western side, right? I mean, I'm sure there's a way to look at the common cold, whether it is through, whether homeopathic medicines.
So there are a lot of different homeopathic medicine, and I think some of the parents who are listening in who have little kids,
Yeah.
right now when they go to ShopRite or Walmart or any of those other pharmacies, they'll see a lot of these different homeopathic medications that have come on the market.
Yeah.
That
And
is
by the way,
because
they are out over the counter too.
they're over the counter
Yeah.
too. So you might have heard of names like Zarbee's or
Yeah.
Solacin
Yeah.
and these other medications that are there.
Yeah.
And since they don't have an FDA control,
Yeah.
they're out there and everybody thinks that it's okay to take them.
Yeah, but I'll
And-
tell you, I walked into Whole Foods the other day. They had an entire aisle of homeopathic medicine. It was like, homeopathic medicine heaven, you know. I mean, but I caught up, yeah, but it was the same as looking at Tylenol, which is like 12 different varieties, like a shampoo, right? I went there, I had no idea where to begin looking for medicine, and they're mostly descriptive to make you feel better, to make you feel miserable, to make you do this, this, this. So I really don't know as a parent. I think our world is only becoming more confusing.
Right, and most of those medications that are out there, that the cough and cold medications and the multi-symptom medications, will have the stamp that do not use under 6 years of age or under
Right.
4 years of age,
Right.
and parents are very scared.
Yeah.
So the issue with all of those medications was that they were not being used appropriately, and the
Right.
side effect profile of those medications was the danger.
We're
And
still
that's
talking
why.
about Tylenol. And
No.
those
I'm talking about a
medications.
lot of these other medications:
Okay.
Dimetapp, Sudafed, Robitussin.
Okay.
So all of these other medications that are there on the market,
Yeah.
they do have issues with them. So you have to make sure whichever one you're taking, that your age of your child is appropriate for that medication. You check with your physician about which medication to take
Yeah.
and how to take it.
Right.
Whereas some of these homeopathic medicines like Zarbee's or Samlasan, they don't have any of those
Right.
indications on there because FDA doesn't regulate them.
And it's okay for me to tell my doctor, right? Hey, I came across this in Whole Foods, and this is what I saw. Do you think it's right or wrong? He won't laugh at me, right?
No. He should not, because that's the only way you're going to bridge the gap.
I mean, you know, as a parent, you're scared.
So the issue is to make sure that you know what you're taking, and all of these medications, the multi-symptom ones especially, they have a lot of different medications in there as components. So you need to know what the component is,
Yeah.
what the milligram amounts are in that dosing, and how to dose it appropriately.
You know, that would make me a doctor, right?
But you will be surprised how many people do not know the difference between milligrams and milliliters. And most of the pediatric medications are dosed based on that. So it is extremely crucial to understand that.
Yeah. It
Okay.
doesn't say that on the packaging.
It does, but we don't read it properly.
It doesn't say on the packaging, please know that this is in milliliters or milligrams.
No, but
Yeah.
all of the medications, they come in with a certain dosing. So,
Right.
if there is a concentration that is Tylenol 160 milligrams in
Right.
5 ml,
Right.
and your dose should be 120 milligrams,
Yeah.
then basic maths, it's 3.75 ml.
Yeah.
And if you don't calculate that appropriately,
You could go
then,
wrong.
then you go wrong.
Very badly.
And Tylenol is not just a safe medication. It can cause liver failure and even death in a child.
Okay.
So all of these
That's a reality
medications,
check.
that is a reality check. So for a cold,
Yeah.
we want you to go ahead and use home remedies.
Yeah.
So using steam, using
Yeah.
some saline nose drops,
Yeah.
using some Vicks Vapor Rub,
I love Vicks Vapor
and
Rub.
your grandma's haldi
Can't go wrong
doodh,
with Vicks Vapor Rub.
haldi doodh, and your ginger
Yeah.
tea,
Yeah.
and maybe using these other things
Yeah.
before you get into
Yeah.
these other
Every time we do
medications.
this show, it's amazing. You know, the first thing that we learn is that if something happens, don't just go and grab or look for the bottle of medicine. You know, right? So there's always a phase two, right, doctor?
Of course, and I know we're getting very end of time here. So if there is any calls, any questions, please call in. And if
They
we
can also
don't,
write to
if we
you.
don't get to
Yes.
the questions, you can always go ahead and write to us either through our website, mywholechild.org, our Facebook page, or even our just a direct email address, drmehrotra1@gmail.com.